Thank you very much, Mr. Chairman. I'm going to follow up a little bit, although maybe a little different than what Dr. Burgess was going after. And I understand some of the concerns, but the Supreme Court has held that an agency has a right to change its policies so long as it supplies a reasoned analysis for that change. An agency, however, may not change its policies in a way that simply disregards rules that are still on the books. FDA's current regulations specifically exempt clinical labs from medical device registration and listing requirements. 21 CFR 807.65 sub little I. In an attempt to avoid directly conflicting with this regulatory exemption, the proposed guidance documents claim not to require a clinical laboratory to register and list their tests, but to create a new notification option where labs could notify the FDA of the types of LDTs they develop. If, however, a lab does not submit a notification, it will then be subject to registration and listing requirements along with the related fees. Now, it doesn't seem like there's a whole lot of choice in there. So, Dr. Shern, where in the statute does FDA claim the authority to establish such a notification process?
So, they are subject, the labs are currently subject to registration and listing. Our interest for many of these is to know which are the LDTs out there so we can use that information to then determine the risk classification for them. We have offered as an option for not complying to provide the notification. I'll tell you the reason we did it. If you notify and you don't do instead registration and listing, you're not subject to the device tax. That's what we did. Plain and simple.
Because there's a lot of pressure regarding the medical device tax?
No. We, in looking at this, said, you know what, for a lot of these too, if we're not going to then subsequently actively regulate them, because they're going to be under enforcement discretion, we weren't going to trigger all the other things that come with that. And that's what we try to do. We were trying to give labs a break.